Yeah, so I mean, I think that the first thing I want to say is we're talking a lot about risks today, and they are very important. And really identifying risks, particularly modifiable risk factors, is really important. At the end of the day, you can't change your age, but you can change, for example, your body mass index if it is a little high. And so, really concentrating on those, I think, is those modifiable risks. But the other thing I really want to press home is overall, even if you do have a diagnosis of gestational diabetes, your chances of a good outcome in pregnancy is pretty high. And what we're trying to do is making it the highest we possibly can without frightening you and saying, well, look, these are the things we can do to make it that even better likelihood of a good outcome. But actually, overall, hopefully things will go well, or anyway, but we let's do together the best things that we can do to make it the best outcome. Modifiable, and some of them are not. So age is pretty much, it is a non-modifiable if you get there and you're pregnant. Obviously, if you're thinking about pregnancy, then it is potentially, you could think about maybe pregnancy earlier than maybe initially planned, if you recognize that the age is an issue. Where your ethnicity and your heritage, that does play, it has an impact in your risk, your background risk for type 2 diabetes and gestational diabetes. Again, not something that we can change, but it's important to know about it because it helps you and your healthcare provider to give you some accurate risks on the chances of you developing gestational diabetes, which is important because that can then help shape your care pathway and how often you need surveillance, how much testing you need, etc. And then there are modifiable things that we can do, like achieve a healthy weight going into the pregnancy, and that optimizes your health, and also ensuring that we don't put on too much weight during the pregnancy. So excessive gestational weight gain, we accept that women will put on weight during their pregnancy, but excessive gestational weight gain is associated with increased risk of complications, including gestational diabetes and other pregnancy-specific conditions, for example, high blood pressure or preeclampsia. So I think it's very important to think about those things as well. There are other things that put you at higher risk from your history. For example, if you've had a previous pregnancy complicated by gestational diabetes, again, that's noted. It's not something that we can change today, but it's noted and is important for that risk profile. And if your baby has been big, your previous baby was big at birth, that again is another risk for gestational diabetes in this pregnancy. So there are a number of things we can go on. Polycystic ovarian syndrome is another condition that predisposes to gestational diabetes. So there are a number of things that we can do, and developing that risk profile, understanding that risk profile, modifying what we can modify, and then going into the pregnancy, eyes open, knowing that we've done the best we possibly can, and then creating the care pathway that's appropriate for your level of risk is what us clinicians spend all our time doing.